Good evening, ladies and gentlemen, and welcome to the Media Center here at the Office of the Prime Minister in Kingston, Jamaica. It is Monday, August 9, 2021. Prime Minister, the Most Honorable Andrew Holness, will update the nation on deliberations and decisions concerning the changes to COVID-19 protocols. With the Prime Minister this evening, we have the Honorable Christopher Tufton, the Minister of Health and Wellness. We have the Honorable Desmond McKenzie, the Minister of Local Government and Community Development. Along with the ministers, we also have the Chief Medical Officer for the country, Dr. Jacqueline Bisesa McKenzie, as well as the Permanent Secretary here at the Office of the Prime Minister, Mrs. Audrey Sewell. There's a very special guest as well with us that the Prime Minister will also announce later on in the proceedings. Now let me turn over to Prime Minister, the Most Honorable Andrew Holness.
Thank you, Naomi. Good evening, Jamaicans here and overseas, and others who may be watching us on social media. I want to start today, firstly, by acknowledging some issues which are tangential to the pandemic, but which deserve some statements from the government. Firstly, I want to address the issue of a young Jamaican lady, young girl, whose hair, it is alleged, was forcibly cut by security forces, or so the allegations go. I've been following this story very closely, and yesterday I met with the Commissioner of Police and inquired of the status of the investigations that are ongoing. The Commissioner and I are of the same view, that in post-independence Jamaica, we should not be having this kind of conversation about people's hair choices and whether or not the state has any right to cut someone's hair. It is totally against what we believe in as Jamaicans, and I want to place that on the record. And I've asked the Commissioner to put the full investigative force at his disposal to find out whether or not there were any administrative breaches and any criminal breaches at play. There are issues as well as to how our citizens are treated when they are in custody, and we want to know if anybody's rights would have been abused. And on the matter of rights, again, tangential but related to the pandemic, would be the issue of another young Jamaican expressing his views about the management of the pandemic and about me as Prime Minister. I want to say categorically, with great certainty, that we are a free country, and you are entitled to express your views about how you feel as a citizen the government is managing your affairs. Of course, you would have to do so within the confines of the law, and we do have laws on our books regarding the use of profanity, and there is a standard of decency. But I wish to reaffirm that every Jamaican, regardless of who you are, what station you are, that you have a right to express your views. And as your Prime Minister, it is my duty to ensure that those rights are protected and reinforced. I have here with me today a special Jamaican. Her name is Dr. Sandra Lindsay. She is from the great parish of Clarendon, and she is a critical care nurse in the United States health system. And you know, critical care nurses, the CMO will agree with me, they are the elite team of the nursing cohort. She obviously has done very well in the United States. She recently received her PhD in healthcare, and she was acknowledged for her contribution to the American healthcare system by President Biden. And it is an honor for her personally, but certainly all Jamaicans can take pride in the recognition and honor that she has received. And on that matter, let me take the opportunity to thank our Olympians and to congratulate them. They have done an amazing job in the pandemic. And we have seen some heart-touching stories, the behind-the-scenes stories of their own personal struggles and how they have coped, and they have done well. And we are indeed proud of them. It has lifted our spirits during this very difficult time. So, based on the latest report from this morning, Jamaica recorded 281 new cases of COVID-19 yesterday. Our cumulative cases of COVID-19 are now 55,140, and 1,231 persons have died. I offer my sincere condolences to everyone who has lost family, friends, loved ones, and colleagues, and I pray for a speedy recovery for those who are in hospital fighting the virus. I continue to pay tribute to our hard-working healthcare professionals who have been dealing with this pandemic for over a year. And I want to, later on in the press conference, address the issues surrounding our healthcare workers. The present numbers would be disheartening for many. Those who are on the front line, who see the beds filling up, who see the patients suffering, will not always easily understand the deliberations and the decisions that are made at the level of cabinet or from an executive policy level. And it can be frustrating, disheartening. And I want to encourage them today by saying that when we make our decisions, we obviously have to take everything into consideration, but we take your safety and your effort into consideration as well. We appreciate what you do, and you are on the front lines, and we have your backs. We are supporting you 100%. And the Minister of Health will come up shortly, and we will have more to say about the support that we have to give to our frontline workers who are on the battlefield every day with this virus. Now, we're seeing a sharp increase in the number of new cases of COVID-19, as well as hospitalizations. In June, we recorded 1,572 new cases, averaging 52 cases per day. In July, we recorded 3,071 new cases. For July 1 to 13, we maintained the average of 52 cases per day. And for July 14 to 31, however, the average increased to 135 cases per day. For the first 8 days of August, we have already recorded 1,903 new cases. We are currently averaging 238 cases per day, which is nearly 5 times the daily number of cases up to July 13th. The Ministry of Health and Wellness has advised that our test positivity rate and our hospitalization rate are showing rapid increases, as demonstrated in the graph now projected, which shows that our test positivity rate has been rising rapidly and is now at 27.6%. I have a graph that should be displayed now. I want us to pay attention to this graph. It shows our daily confirmed cases of COVID-19 in blue, while the red line shows the 7-day moving average of new hospitalizations. You can see that our daily hospital admissions are now at the same level as our previous peak in March, April 2021. We now have approximately 500 of 700 beds allocated for COVID-19 occupied island-wide, and a number of our large hospitals are over capacity. The next graph shows our reproductive rate, which represents the average number of additional persons infected by one infected person. And this remains unacceptably high at 1.3. The color coding shows that we are in the exponential increase zone, meaning that we will have a very rapid increase in numbers, which is primarily due to how each citizen is conducting themselves within the pandemic, and particularly how an infected person is conducting themselves. Clearly, there is a lot of movement by infected persons, and this would have come about by not observing the quarantine, not observing the isolation requirement if you are infected, not observing the curfews, not observing the gathering limits. And this kind of behavior will lead to an increase in our numbers. At the press conference 2 weeks ago, on July 26, 2021, I had announced some tightening of the measures. I had also indicated that if we did not see a reduction in our numbers, further tightening of the measures would be necessary in order to give us a chance to reopen schools for some face-to-face learning in mid-September. I want to just pause here a minute to say that the government placed a lot of thought into what we're doing. We placed and developed a strategy. And that strategy was that we saw the rising public pressure. We saw the fatigue and tension in the society that was under the imposition of serious restrictions from February this year going into June. We heard the cries and complaints of businesses, of just general citizens who felt that the restrictions were having a psychological impact, having an impact on their business and their livelihood, and needed a break. And we saw that being expressed all over, on the news, on social media. And as I said earlier, people have a right to express their views about lockdowns and vaccines and so forth. It is their right. And the government must respect that and listen. And we did. We did that knowing Minister Tufton was first out of the block to say, we will have another spike. The CMO was clear, we will have another spike. In Parliament, I was clear, we will have another spike. How do we treat with that? So one, increase surveillance and monitoring. So you will recall that 4 to 5 weeks ago, we sounded the alarm that we're seeing the uptick. And we started to adjust measures as we moved along. And so in keeping with our strategy of being gradual, of being data-driven, of having a high level of surveillance, we have been tightening the measures in anticipation and in a preemptive way to ensure that we don't have an outbreak that challenges our health system, certainly measured by beds occupied. We are getting to that point, but we are confident that the measures that we will put in place will have an impact in reducing the numbers. You will have to note as well that the increases that you are now seeing, as the CMO would have pointed out on many occasions, that many of it would start 2 to 3 weeks ago, that you would be starting now to see the infection rising. So we are in that phase, a phase that we expected and we have planned for. It is not a time for the public to panic. You should know that the government has thought this thing through and how we will have to address it. And we will move through this as a nation, as one country. I will now invite Minister Tufton to give his specific updates on certain issues in the health sector. Minister Tufton.
History, fear, hope, and love, but the greatest of these is love.
Thank you very much, Prime Minister. Members of my colleagues and other members in the audience, good evening to you all, ladies and gentlemen. So, as the Prime Minister said, our main COVID-19 indicators continue to trend in the wrong direction, as evidenced in the increasing numbers of infections reported on a daily basis. Just to give you some of the basic statistics, the geographic spread of the virus is now at a high level, between 50 to 75% of communities having active cases over the last 2 weeks. The reproductive rate remains above 1, which is not good. It's actually at approximately 1.3. And simplifying that, it means that more people will be contracted or infected than those who are currently carrying the virus, to the tune of 1.3. With a 7-day positivity rate at 27.6%, again, not a good number. You will recall that we had gone down to just under 7%, I think, or just above 7%. So we're moving in the wrong direction. As expected, with the increase in COVID cases, there is a parallel track or a direct relationship between bed occupancy levels, which would increase. And we're seeing that occurring to the point where we classify the increase, the rate of increase, and the current status as putting our COVID beds under very high pressure. Up to yesterday, with respect to general occupancy, 6 hospitals were in the red alert zone, which means that these facilities currently have 84% or greater bed occupancy, while 4 are in the amber alert zone with greater than 74% of their beds currently being occupied. Currently, as it relates to COVID-19 occupancy beds, 8 facilities are at over 84% of its current bed capacity, placing it in the red alert zone. And these facilities include our Cornwall Regional, the Savlamar Hospital, Port Antonio, St. Anne's Bay, Mandeville Regional, University Hospital of the West Indies, Princess Margaret, and Spanish Town hospitals. In terms of the field hospital beds, we have activated our field hospitals. There are 40 beds at Spanish Town Hospital and 32 each at the Falmouth and St. Joseph's hospitals. 2 other 40-bed facilities are to become available for a total of 716 COVID beds. So that's ultimately what we will put in place. Now, we do have flexibility, but I think we have to appreciate that if we are to convert regular beds into COVID beds, then it means less regular beds are going to be available. And what that means is that we will have to advise based on availability as to elective procedure or non-emergency procedures going through this phase. In terms of vaccination, supply, and administration, the objective continues to be 65% of our population. Our target between now and the end of September is to do some 700,000 persons. Up to Sunday, August 8th, 2021, some 374,667 doses of COVID-19 vaccines have been administered, 240,696 first dose, 131,632 second doses, and that's of the AstraZeneca. We did receive, as we had said, a limited supply of Johnson & Johnson, primarily for our athletes, and we have administered some 885 doses, and that's a single dose. We, I think, did fairly well. We, meaning the team and the support stakeholders across the country and Jamaicans who came out. since we got the 300,000 donation of AstraZeneca from the UK. Over that 6-day period, we administered some 63,000 persons the first dose, and in some instances, second doses. And I just want to use the opportunity to thank the public for coming out and for those who participated in supporting. There were some holidays there, and I know it became more challenging because of those holidays. So 63,000 is a reasonable number. We have also had success with some community-based intervention, and we treated those as a sort of pilot for what is to come, because the intention is, and this is something, Prime Minister, you led the discussion today at Cabinet, to try and be more effective to now take the vaccines to the population centers, to the communities. So instead of the larger blitz that we mobilize persons to come to, even though some of those will continue, we're going to be spending some time now to bring the sites into communities, rural communities, urban centers, and so making it a lot easier to mobilize the population, the civic leaders, the political leaders, the church leadership to those centers to encourage participation. So we started that in 4 communities in West Central St. Catherine, and also in the Ligani St. Andrew area. And we had, in the case of St. Catherine West Central, some 900 persons benefiting. In terms of the Ligani area, the Sovereign Shopping Center, we had some 600 persons benefiting. So it works. It does pull away the personnel from other things that they have to do. So we have to manage it, we have to schedule it, but it's going to be the next most popular approach to inoculating the population. We are finalizing the plans for this week's community rollout, and will advise members of the public in short order. We do plan to have our regular COVID conversations on Thursday, but I believe there are a few locations that are already lined up between now and then. We'll present a more comprehensive list of that community intervention. A number of persons, Prime Minister, have been discussing the communication strategy. And, we are always willing to adjust to the concerns that are raised. We have an open mind in terms of the approach, and we do appreciate the constructive criticisms that are levied. And we have been listening. I believe that based on the discussions with the team, once we get to the community level, part of that communication strategy is not going to be from top down, but a parallel track at the level of the community, using the community leadership and key influencers. So the elected representatives are mobilized and will be mobilized. The church leaders will be mobilized. And so what you will find is a closer relationship between those who we are targeting and those who are influencing. And we do believe that concerns, queries, suspicions are going to be better able to be dealt with, as opposed to having mainstream media alone. We'll still provide mainstream media coverage, but the pivoting to community-based approach will also see community-based intervention in terms of communication, the town criers and so on. So we're going to be working on that. In the meantime, we do encourage persons to continue to schedule their appointments using the 8881 Love line. That's 888-663-5683, or the website. But again, there have been some criticisms levied. I do watch the media space around appointments versus walk-ins. And I do know that some persons have complained that they get no different treatment, whether they walk in or they set an appointment. And in some instances, that may be the case. We do try to give preferential treatment to those who take the time to make the appointments. But what I have instructed the team not to do is to turn away persons, because the truth is, not everybody is internet savvy, may not have a phone, or for whatever reason, if you know there's a location that is administering and you can access that location, the intention, the general policy, the general rule is not to turn away persons. However, for order and better planning and better management, we do prefer that you call these numbers or set your appointment via the web-based platform that we have, but all are welcome once you're over 18. In terms of supplies, Prime Minister, closing here, we are still on track to receiving the 1.4 million doses of vaccines. We're already in receipt of 300,000, as you would have heard, and we're expecting another shipment of vaccines by the end of this week. Now, I don't like to give timelines when it comes to a scarce commodity where we don't control all the variables, but based on the hard work of the Ministry of Foreign Affairs and the other members of the team, including the Prime Minister, it is becoming more of a predictable scenario that we will see another shipment this week, and that's good news. We're anticipating to receive over 470,000 doses in August, another 420,000 doses in September, and again I say that the 700,000 target by the end of September will mean some 30% of the overall population, which would be a very good development and certainly a pace that would certainly hedge against the threat of the virus. So we're working on that. These will be other brands, not just the AstraZeneca brand, and we will keep the country informed. In the meantime, however, the AstraZeneca brand will be the brand that is now being pushed out. Prime Minister, just to close by saying we cannot not encourage persons to continue to observe the protocols. Interestingly, the presentation to Cabinet today indicated more young persons being infected, more young persons being hospitalized, and I must say I was concerned that I saw more numbers in the 50 and younger, 40 and younger, 30 and younger, who are not only hospitalized, but who have passed as a result of COVID. It means none of us are safe. All of us must observe the protocols and take the vaccine when the vaccine is available. Thank you, sir.
Thank you very much. We are observing all the protocols here in the press room of the OPM. Minister, I gather that we may even have better news as it relates to vaccines, that we may have some more vaccines coming of the AstraZeneca brand. So we really have to go full force. It's now my great pleasure to invite Dr. Sandra Lindsay to say a few words to Jamaica regarding her experience in the United States, her experience with the vaccines and the variants, and the effectiveness of the measures, particularly the infection prevention and control measures. Dr. Sandra Lindsay.
Prime Minister, the most Honorable Andrew Holness, Ministers, Chief Medical Officer, ladies and gentlemen here in the room, at home and abroad, thank you very much for inviting me this evening to address my fellow Jamaicans. Thank you for the warm welcome I received coming home and since I've been here. I must say that I've been very impressed with the consistency of the strategies here to minimize the spread of this deadly virus. Every business that I've accessed, I've had to hold out both hands for a healthy dollop of hand sanitizer and have my temperature taken. So I'm very impressed. I'm also very encouraged to hear that we have vaccines on the island and we have more vaccines coming. So as you may know, I am the first Jamaican American to be vaccinated on December 14th, 2020. When I had the opportunity to be vaccinated, I did not hesitate. I showed up to the site 1 hour earlier, waiting for the vaccine to arrive because I was so eager to get the vaccine. Having worked on the front lines for the past 18 months, as the Prime Minister mentioned before, I'm a critical care nurse. I'm also the director of the Critical Care Nursing Division at Long Island Jewish Medical Center in Queens, which was heavily affected. We were the epicenter of the epicenter in New York. So what I worked were 7 days per week, 16-hour days on my feet. It was all titles out the door. It wasn't Sandra Lindsay, Dr. Sandra Lindsay or Sandra Lindsay, Director of Critical Care. It was Sandra Lindsay, a nurse, because that's what I believe in. I work alongside my team. This is a crisis, and so I'm going to be out there right alongside them in those heavy N95 masks that feel like they're cutting off your face. So I empathize and I sympathize with my fellow frontline workers who are here. I know what it feels like. And even when I went home, some days not even remembering how I got home, I had to be thinking, where am I going to put people when they come in? We can't turn them away. Our mission is to take care of our communities, and we're committed to that. So where are we going to put these patients? And then where am I going to find staff to take care of the patients? So these were the things that I had to deal with every single day. And every day I would leave my house. Sometimes I'd take a video or I'd snap a picture and send to my family and friends. I'm going out to what feels like war. And I don't know if I'm returning. I'm a sleeper, so people know me very well. I could sleep through a storm. And there is one particular night where I got home and I was afraid to close my eyes because I was trembling, I was exhausted, but I couldn't close my eyes because I thought I had gotten infected. And I said, God, please don't let me die in here alone. But I took out my white rum and I rub up myself and I got some tea, turmeric, ginger, garlic, honey, lemon, and I took a shot of that and I said a prayer and I went to bed. I didn't have COVID. It was exhaustion. That's what we had to go through day after day after day. So when I got vaccinated, it was like a burden, a big boulder just rolled off of my shoulders. And I immediately felt protected. I did it because it is my professional obligation to save lives. And I know beyond wearing our masks, which we should always be wearing, because COVID is still here. Beyond meticulous hand hygiene and social distancing, we needed something more powerful, and a vaccine is our best defense against this virus. We've been getting vaccinated for years. This is not new. So please don't let the propaganda on social media prevent us from getting back the health of our country. I also did it because of personal fear. As you heard me said, I was afraid to close my eyes. I was fearful of getting ill, ending up in one of my ICU beds as a patient, or even dying. I was afraid that I would get infected so much that I couldn't be on the front lines with my team. I would feel terribly guilty. I also did it for all of us because I don't, I'm not just one person. I'm part of a larger community. And so I saw it also as my civic obligation to help where I live now, which is the United States, to get out of this predicament that we find ourselves in. And so I'm appealing to you, fellow Jamaicans, to help the country to get out of this predicament that we find ourselves in. Inaction is not an option. It's not just going to miraculously go away. We have the power to take back our lives and our livelihoods right here in our arms. Now, this variant that's going around, as you can see, when you look at the United States map, the states that have a higher vaccination rates are not having so much a problem with the variant as states that have a lower vaccination rate. In Jamaica, we have a lower vaccination rate. And so it just leaves room for these variants. If it's not the Delta, it's what's going to come after that to just run rampant and take over our country. If we don't increase our vaccination rates, and again, as Dr. Tufton has said, we have vaccines here and we expect more coming. So we don't have any excuses. We can beat this. Now, if you're like me and love track and field, I was jumping up in my house during Olympics. And particularly when I saw the team of women that interview, when they came together as a team. It's not one person that did it. It's not two. It's the entire team. And so that's what it's going to take, Jamaicans, for us to come together as a team to fight this virus. So I appeal to you. Do not listen to the propaganda on social media. I was supposed to turn into a ghost 24 hours post taking the vaccine, and I am still here in the flesh. And I tell you, it feels good to be home. I pray day and night for God to spare my life, to be here. And so I am so honored to be here, to be addressing you today. I know we can win this. I know we can win this. We have the fastest woman alive. We can run this COVID-19, but it's up to us, and the power is right here in our arms. So I wish you all health, continued success in everything that you're doing, and I'm appealing to you. Work with the government, because we can't get back our life and our livelihoods, and I love to come home. So let's do this together. I am here. Whatever capacity you need me to help in, I am here to help.
Sandra, you had me between laughter and tears. Such a compelling story. And I hope that Jamaicans listening will relate to what you're saying and take your advice. It's good advice. Get vaccinated. Now, the following changes to the Disaster Risk Management Act will apply for a 3-week period from Wednesday, August 11, 2021 to August 31st, 2021. Let's start with the curfew hours. Effective Wednesday, August 11, the curfew hours will be adjusted as follows. On Mondays to Fridays, the curfew hours will be from 7 p.m. to 5 a.m. the following morning. On Saturdays, the curfew hours will be from 6 p.m. to 5 a.m. on the Sunday morning. On Sundays, the curfew hours will be from 2 p.m. to 5 a.m. on Monday morning. Closing hours for establishments will generally be 1 hour before curfew begins. And I want to just pause there a little bit. The strategy of the government, you will realize, is to gradually ease in the tighter measures. For various reasons, we have analyzed how we have implemented measures in the past, and we would have heard the concerns, criticisms, and suggestions of our stakeholders who have said that the implementation of tighter measures steeply sometimes causes congestion and panic. So we have moved the curfew hours down gradually. This is both a signal and opportunity to our stakeholders, business people, transportation operators, citizens moving around, that those who need to rearrange their business hours, who need to stock purchase items, schedule appointments, that they get enough notice period. And so they are in the frame of mind to receive the tighter measure. So we have gradually eased them in over a 4-week period. So we are now back to where we were in terms of measures in early May, thereabouts, when we were at a 7 o'clock curfew. We have not yet implemented a no movement day. A no movement day, however, is possible. And in fact, no movement days, if the numbers do not show signs of improving, will probably come, give it 2 weeks from now. So we are gradually easing in the tighter measures so that people can prepare and have enough time to adjust their scheduling and so forth. So the tighter measures are being implemented, and I'm saying to Jamaicans to be in an expecting mode that even tighter measures could come depending on the numbers that we're seeing. We're always conscious that at the same time we are trying to control the pandemic, we don't want the collapse of our economy. And so that's the balancing game that we have to be playing. Beaches, which are not under management or control, are to be closed. The beaches that remain open will operate under the existing protocols and subject to tighter operating hours as follows. Mondays to Saturday, 6 a.m. to 4 p.m. and on Sunday, 6 a.m. to 1 p.m. Rivers will be restricted to be used only for domestic purposes and for river rafting in accordance with the established protocols. The operating hours will remain the same as for beaches. Places of worship will be restricted to having no more than 50 persons in physical attendance, including clergy and support personnel. No crusades, conferences, or conventions will be permitted. Just to be clear on this, that the 50-person limit is still subject to the physical distance rule. So if your church, in applying the 1 to 40 square feet rule, that's the physical distancing rule, can only accommodate 30 persons, then 30 is your limit. If your church, in applying the physical distance rule, could accommodate 200 persons, 50 is your limit. I just want that to be clear. Now, nightclubs and certain places of amusement, such as clubs and discotheques. Do we still have discotheques? Are to be closed. Events. No small or large events, for example, concerts, parties, tailgate parties, round robins, will be permitted. During this period, events, as I have described, will be strictly prohibited. Let me say that in terms that everyone can understand. No permits will be given for any events, and all events which are kept illegally will be closed by the police. As I've said, I've met with the Commissioner of Police last night, 3 hours, going through a variety of things, and one of them is the strict enforcement of these measures. All the measures that we have put in place here will be strictly enforced. And I want that to be clearly understood. Gyms, restaurants, zoos, parks, and bars are to operate at a maximum of 50% of their capacity. Capacity is determined, as I've said before, on the physical distance rule, 1 person to every 40 square feet of usable space for the area. For weddings, no more than 50 persons will be permitted to physically attend a wedding. For annual and extraordinary general meetings of entities, the maximum number of persons permitted to attend physically is 50. For public events and hosted by public entities, such as handing over ceremonies, launches, groundbreakings, opening ceremonies, things that I would normally do, no more than 30 persons are permitted to be in physical attendance. As a reminder, the limit of 30 persons remains in place for funeral services and burials. This includes mourners as well as clergy and any support personnel. Burial can be done only on Mondays to Fridays during the hours of 9 a.m. to 5 p.m. and the time for conducting the burial continues to be limited to 30 minutes. Our travel protocols remain the same. All persons are therefore required to present a negative test within 3 days prior to their travel date. The list of countries from which travel to Jamaica is not allowed remain the same, namely Argentina, Brazil, Chile, Colombia, India, Paraguay, Peru, and Trinidad and Tobago. The Ministry of Foreign Affairs and Foreign Trade is working with the Ministry of Health and Wellness to work out arrangements to facilitate the entry of university students from Trinidad and Tobago who are pursuing studies in Jamaica. We are now clearly seeing our third wave. Our focus in crafting the measures that will apply over the next 3 weeks has been on controlling spread sufficiently to allow us to reopen schools, to facilitate structured face-to-face learning in September. As it stands now, this goal is severely challenged. We're still hopeful that we would be able to have some form of reopening. We had targeted mid-September. But it really depends on what we as Jamaicans do in the next 3 to 4 weeks. It really depends on what we do. And there are a couple of things that we know works. The wearing of masks. There is a sense of complacency. Now, the complacency applies to persons who know better, but just don't do it. But I had an occasion to interface and interact with a group of persons on the weekend. They weren't wearing masks, and they just didn't see the need for it. And a lot of it is just ignorance. They simply just don't know. I mean, it's a tough time. Sometimes we stand at this podium and believe that we are speaking to the world, and the world is hearing us. And that is not the case. There is a percentage of Jamaicans who will listen to us, who will heed our admonitions and warnings. There is a percentage of Jamaicans who will listen to Dr. Lindsay. But there is a vast number of Jamaicans who tune out. As far as they are concerned, COVID is not their problem. The public health risk that their behavior creates is not a concern to them because they don't see their behavior as creating a public health risk. And as far as they're concerned, why should they be prevented from enjoying their life and pursuing their happiness because someone with weakened immunity or other immunocompromised situations needs to be protected and shielded? Can't we find a better way so that we only shield those who will have an adverse impact from the disease while everybody else gets to pursue their happiness? And there are those who genuinely feel that way and will not follow the protocols. And there are those who consider it an affront to suggest that they should take a vaccine. How dare you impose on me to put something in my body that I don't want? And, you know, I see it in the cabinet, I see it in discussions with persons, it's very difficult for the persons who hold differing perspectives to see the other perspective. It's very difficult. There are those who feel that those who want to just go about and live, they are selfish. And those who just want to go about and enjoy their life can't understand why they should sacrifice for those who are vulnerable and weak. And it's a real challenge in the society. So the government can't just pursue one hard line. The government has to balance. So it has to give a little here and then take back and then give a little here. And it is a very difficult position for any government in a democracy to be in, because it requires a government to impose on persons requirements and restrictions that infringe on individual rights. And this is not a position that I take lightly. And I mean, no one wants the pandemic to end more than I do, because we spend so much time as a government trying to deal with it, and we are distracted by other things. So we have reached a point in the cabinet today, and I believe other members of the society have reached that point as well. I've gotten a few calls from members of the private sector saying that, you know, we can't continue imposing restrictions and locking down, and that is not a long-term solution. The various partners and stakeholders and citizens have sacrificed quite a bit. It hasn't come to the fore. People don't see the number of persons who can't pay their mortgages, who are on the fringe of losing their homes, the businesses that are about to collapse. The average person not seeing all of those things, and that's partially due to how the government has managed the pandemic. They're not seeing the households that just don't have income and don't have food. And that's, again, you know, the government has managed the pandemic in a particular way with ensuring that we do conditional and non-conditional cash transfers to households. So by and large, you know, there is a sense that there is normalcy. But seething underneath this sense of normalcy are many threats, including the threat of civil unrest and social disruption, which the government has to pay keen attention to. And sometimes the argument will come, oh, the government isn't following the science. I urge people to be careful about what you say and think very carefully, very deeply. If the government were following the science, the government would mandate vaccines. In managing the pandemic, the government has to consider everything. We have to consider what the CMO recommends and the science recommends. We have to look at what other countries are doing, and we have to look at the investments in the country. We have to look at people's employment. We have to look at people's lack of income. We have to look at the psychological and emotional fatigue that people are under. And then we come to a balanced decision. It is that balance that has kept the society together. There are those whose whole existence is to tear that balance apart, to find critiques and criticisms that are not founded, not properly thought out. But in that balance is also that right to do it, because they keep us on our toes and they ensure that we have to think very carefully about what we do as a government. And I want to assure this nation that you have a government that listens, that cares, and that takes the right decision to keep the country stable and on a path to recovery. As it stands now, and we have discussed in cabinet, the government is not thinking about or inclined to mandate any vaccines. In fact, we don't believe that is something that would meet the constitutional test. So there is no need for any social disruption in that regard. The objective of the government, however, is to ensure that, one, vaccines are widely available. And we had, as a government, we have ensured, Minister Tufton can tell you the same, or I can say it to you, that we have ensured that whatever vaccines are available in Jamaica are vaccines that meet the highest standards of approval. And we have not brought in any vaccines unless they were, first of all, WHO approved. Other countries would have gotten a start ahead of us because they took certain decisions. We didn't. We waited because we understood the high level of suspicion about vaccines in our country. So when we go to the public to say, take the vaccines, we are confident that we are giving you the best vaccines that are available. And so I can stand here with confidence, having taken the vaccine myself, to recommend it. So that's number one, to have the vaccine widely available. And then number two, to ensure that people understand how the vaccine works and they can access the vaccines. So Minister Tufton pointed out that we are going to pivot in our public education to go to the communities. I personally am announcing now that I am going to be hitting the road. I'm going to go into the nooks and crannies. In the same way that I went about asking you for your vote, is the same way I will go about asking you to preserve our lives and livelihoods and preserve your life and livelihood, and to encourage you to take the vaccine. So we will have a roadshow going right across Jamaica into the nooks and crannies to get our people to understand and to be aware and to take the vaccines. And thirdly, people who are vaccinated can't be, in the same way as persons who are not, certainly in critical service areas and in terms of provision of service, because the challenge that you face, as pointed out by Dr. Lindsay and the CMO and what we are seeing, is that the unvaccinated population is at the highest level of risk of infection and transmission versus the vaccinated population. Both have a risk, but the risk is sharply different. And so the persons who have taken onto themselves the civic duty of being vaccinated should not bear the same burden as those who don't take on the civic duty of being vaccinated. And so the government has a duty and responsibility to create incentive systems, incentive compatible systems, to ensure that persons choose to take the vaccines based upon those incentives. And we have started. We have put in place systems such as giving a cash transfer to persons over a certain age group and under a certain income level if they get vaccinated. And we will continue to put in place programs like that to encourage persons to be vaccinated as a reward for taking on the civic duty of minimizing the risk to the rest of the society by getting vaccinated. So in conclusion, I am looking forward to the support of all Jamaicans in ensuring that these next 3 weeks of measures will be successful in bringing down our numbers so that we are able to open schools, even under different structures and conditions, to our students who have been out of face-to-face learning for such a long time. And the learning loss is almost, at this stage, irrecoverable. But we'll give it our best effort for September to open our schools. Ladies and gentlemen, thank you.
Thank you, Mr. Prime Minister. May we then now ask members of the media who are on our webinar on Zoom to use the raise hand feature to ask questions. May I also point out, for those who are on the Zoom, you must click over to become a panelist to be able to ask questions. If you remain as an attendee, unfortunately, we will not be able to hear you, so you have to go over as a panelist. May I then now, sir, ask Mrs. Alicia Dunkley-Willis from the Jamaica Observer to pose the first question. Alicia, good evening. Remember, you must unmute as well. Alicia? All right, let me acknowledge then Stevie Ann Simmons of Nationwide Radio. Stevie Ann, we ask that you unmute yourself and pose your question. Are those on Zoom engaged? All right, I am seeing that they're here.
Naomi, may I?
I'm sorry, who is that?
Alicia, I was unable
Alicia.
to unmute
Okay,
earlier. I'm
wonderful.
not sure
We're
what
hearing you
happened.
now, loud and clear. Go ahead. Thank you, Alicia.
Great, good afternoon.
Yes.
My question was to the health minister. In February, he had announced some changes to the budget for the rollout of the vaccination program, particularly as it relates to expenditure for communications. I wanted to know how does pivoting to a more community-based approach, more granular approach, will impact the budget, whether upwards or downwards. Will it be revised in any way? And also, the Prime Minister had said earlier in his remarks that the Health Minister would address the situation relating to healthcare workers in the public health system. I wanted to know what are the considerations as it relates to the doctors whose contracts were not renewed. I think the Jamaica Medical Doctors Association has said more than 100 individuals. So now that we are seeing that the patient load is challenging the manpower that's available in the system, what are the plans in that respect? Thank you.
Okay, thank you. So the first issue on budget and communication. First of all, there are different components of the communication strategy. Budget may be one issue, but I think also the content and the structure and the approach to the communication strategy is also important, maybe equally or even more important. When I said pivot towards a more community-based approach, it means greater channels for connecting with individuals in communities at the very localized level, utilizing familiar faces and key influencers. So a councillor, for example, in the municipal authority, who has a geographic area, who knows most, if not, well, a large percentage of the population, whether they are the councillor or the councillor caretaker, because we're going to be color neutral, whichever political organization they belong to, they would be in a position to move through those communities and to communicate one-on-one with individuals and to address certain key issues. Electronically, we support that through town criers, the church leaders in the communities who are key influencers. And we have the public health team through the 1,000 community health aides that we have hired, as well as our public health nurses who do field visits to provide some of that basic information to overcome some of those objections and to assist in arming those influencers with the information who in turn would go out and influence, and then we mobilize people in. Now, does that have implications? Now, that means that also is going to be supported by how we structure the national communication strategy, which will be, of course, radio, television, social media. Now, we have to be relevant to the challenges. So it's an ongoing assessment, in one instance to get people out, in another instance to convince persons to believe in vaccines and to overcome the popular sentiments that are raised as objections. And so that would influence content. If we need additional budget, or when we need additional budget, the cabinet affords us the opportunity to make presentations to the cabinet as to what we're doing, why we need to do it. And of course, appropriate decisions are taken at the level of the Ministry of Finance once approved by the cabinet to provide additional funding or to reallocate funding in certain instances. So we can move funds from one place to the next based on the decision to pump more there. So This is a long-winded way of answering your question. The pivoting really means going into communities, utilizing influencers, adjusting content, structure, and approach, depending on where the needs are. And if resources are needed in that respect, then we reallocate internally or we go to cabinet to achieve additional funds. And that's an ongoing process. As it relates to the staff, the public health team, and I really want to join the Prime Minister and say, you know, Nurse Lindsay spoke to it. I think as a country, well, I certainly didn't appreciate it until I became minister, and I've had to confront this issue. How lucky we are as a country to have the public health team that we have in the field. They are exceptional. They have the passion, they have the dedication, and they work well beyond the call of duty. And I say so without fear of contradiction. It is because of them why we are where we are today. And it could have been a lot worse. And so it is very important, I think, for us to recognize them and to give them support. Now, we did launch a few months ago a staff welfare system or program. And that program attempted to provide support to those healthcare workers, the frontline workers, looking at things like time off, looking at things like rest and relaxation, provided some, hotel accommodation. We have been in discussion with some private sector entities to provide some additional support. And that is going to be ongoing. And I think we're going to have to step that up, given the new phase of the challenge that we face and the fact that we have to keep them motivated and keep them energized and re-energized for the work that they and only them can lead in the field. This specific question around the 100 doctors is one that is going to require an ongoing assessment. There were reasons given why we had to take the decisions that we took in terms of hiring some and not all of the graduates. Where we do need additional support, whether full-time to fill slots or on a part-time basis, I think the ministry is well able through the regional authorities to adjust to take those persons on. But there is a more fundamental issue around numbers of intake versus what the system can cope with based on the established positions. That is going to require a more deep-rooted structural organizational adjustment, which the CMO and her team are working on, and we intend to bring to cabinet, which will mean creating more posts, reviewing the primary healthcare model to add more doctors, and that will see greater uptake of some of those individuals and others to come. Thank you.
Thank you so much, Minister. I hope Stevie Ann, who is our next person to pose a question on our Zoom platform, has her mic open. She's already been acknowledged, but Prime Minister, ahead of her coming in, there are some members of our age community that is asking if you would be able to specifically speak to them concerning those 60 and over. Is the stay-at-home order still in force for them, or unless they're vaccinated? And for employers, they're asking a little bit about the reduced work hours and cleaning up office spaces.
The orders as they are, the RMA orders as they relate to the 60 and over, the stay-at-home measure is still in place. And I would say, even if you are vaccinated, stay at home. If what we have seen with the new virus suggests that you should take all precautions to shield yourself from exposure. So the stay-at-home order does allow you to go about and look about your business and so forth, but it places you under a higher level of alert. So I would say to persons 60 and over, and I know many persons 60 and over are just as fit as persons 40 and over, if not fitter. But the statistics show that age group is at a higher threat level, and therefore you need to take greater precaution.
Thank you, Prime Minister. Stevie Ann, are you unmuted and ready?
Hi.
Oh my
Good.
goodness. I think the internet connectivity is beating you, Stevie Ann. Let's try again. Go ahead.
Can you hear me?
Perfectly. Go ahead, please.
Okay, good. So I have three questions very quickly. One, would the government consider making vaccinated people who have proof that they've been vaccinated exempt from the curfews and other measures? And if so, why? For events which have already received permits, what will happen to those? And three, what's the status of the ENDS program? Has it been suspended for review? Just give an update.
Very good question, Steven. The answer to your first question is a flat no. We wouldn't create an incentive in that way. The curfew hours is designed to prevent movement. So you don't want vaccinated people or unvaccinated people moving. The issue is both can transmit. And therefore what you want to do is to limit that movement, which limits transmission. So there would be no differentiation in relation to the curfew. And then it would be a nightmare to administer. That would just simply encourage all kind of bandulism with cards and so forth. So we wouldn't contemplate that. And nightmare for the police to do that. I've been assured, and the minister is here, I'll ask him to come and address that there were no approvals given for large events or other forms of events up until the 11th, because under the DRMA, how it was structured is that the DRMA would expire on the 11th, and therefore the approvals are related to that. But even so, we did say that if we saw where there was a spike, that we would have to shut down events. So the DRMA expires on the 11th, and the minister can explain further whether or not there was. My understanding that there wasn't, but minister, you can explain further.
Thank you, Prime Minister. In response to the question posed, the municipal corporations and the Office of Disaster Preparedness, ODPEM, are cut off accepting and considering applications from the 9th of this month. So there is no approval for any events of any nature, whether big or small. And the announcements that was made earlier on by the Prime Minister would indicate that with immediate effect, the municipal corporations would not consider any applications of any sort. Prime Minister, since I am on my feet, I would just like to mention a lot of questions have been asked about the staging of events over the holiday period, and the fact that videos have been circulating showing events being held. We did some findings, and the team went out and visited certain events across the country, including the Dream Weekend. And I just want to, for the sake of sharing some information that was put together by the Office of Disaster Preparedness and the SDC, and that based on the level of compliance that was observed at major events across the country over the last couple of days, the average rate of compliance is 59.3, which is considered to be average, fair. There were areas where there were not any compliance at all, and that is the question of the mask wearing and the question of persons congregating in areas. I must say, Prime Minister, and to the nation, that these events that were held over the last 2 weeks was monitored. And we are using the findings of these evaluation that was done to ensure that we tighten the system if and when the measures are lifted. But I want to give the country the assurance, Prime Minister, that these events were not allowed to take place without monitoring, using the police, the Office of Disaster Preparedness, and the SDC right across the country, Prime Minister.
You are saying, Minister, please.
Thank you, Prime Minister. As you just await the sanitization of the lectern, I will at this point acknowledge Ms. Jamila Maitland from TVJ so she can unmute herself, as well as, sir, the ENDS program, sir. Yes,
ENDS
indeed.
program.
This
So
is why 2 questions is necessary.
At our next press conference, I will have Minister Matthew Samuda, who has direct oversight, to give some overview to the country. But the ENDS program is still operational. Persons are still on the platform, and it will now become even more relevant given the tighter curfew hours.
All right, thank you. Jamila Maitland, TVJ.
Hi, good evening, everyone. So I have 2 questions. My first is, I think both of them are towards the health professionals. I want to find out the persons who are hospitalized, what are the figures showing as it relates to those who are vaccinated versus those who are not? And 2, what is the status of the samples that were sent off from June 24 to CARPA as it relates to new variants?
All right, thank you, Jamila. We'll have Minister Tufton respond.
Thank you very much. So the issue of the vaccinated versus unvaccinated who are hospitalized, I think our numbers, and the CMO spoke to that in cabinet today. I may be so presumptuous to speak to what we discussed, and that is that we're assessing the numbers, but anecdotally, and this is from my own interaction with SMOs, senior medical officers in a number of the hospitals who I communicate with periodically, the overwhelming majority are unvaccinated persons. There are a few that are vaccinated, but I mean, the high percentage, and again, we'll await the assessment to determine the specific numbers, are those who are unvaccinated. And I'm inclined to support that view in light of the final analysis, because that is the experience globally, that it is the unvaccinated who are at greater risk. I did say, however, though, that we see a lot more young persons who are not vaccinated, who are being affected and are being hospitalized. And I hope that is a message to the young, that they should also, or the younger population, 18 and over, that they should also get vaccinated. As it relates to the test for the variant strain, I think we're on record of saying that we do believe that it is here based on the movement between countries where it is the dominant strain. We have not yet confirmed its presence based on the test results that we have gotten to date. However, those results up to this point were results that were a little dated, because it takes a while to get back the results from where we send them. We are anxiously anticipating the results of tests that would hopefully reflect more what is present in the population. But we continue to advise caution. Thank you.
Thank you so much, Minister. I acknowledge Ms.
It would suggest that it is here. When you look at all the symptoms and the results that you would have seen, you could safely assume that it is here.
Yes. Thank you, Prime Minister. It's 8 minutes to 8 o'clock, and just to give notice, we'll end at 8. Ahead of that, let me acknowledge Ms. Zara Burton. Ahead of Zara Burton, let me just quickly get one into you, Prime Minister. A lot of employers are on asking if the work from home orders are still in force. They also want to find out if there would then be new work hours during the week. And finally, there are several asking if the government would ask private sector employers if they would be able to mandate vaccinations of their employees.
The work from home orders are still in place, and particularly for the private sector, it was always encouragement for them, and we encourage them to continue. In fact, what I've seen is that has become a modality that is not going to go away even after the pandemic. As our telecommuting capacity increases, that is going to become a feature of work in Jamaica. Certainly in the public sector, we will continue the work from home. We will have to review it. Gotten a lot of complaints, abuses of the system, and the improper application of some of the rules. So it will be reviewed. So maybe not the next time you see me in the press conference, but the following time I'll probably have something to say on how we will rethink the work from home order. As to whether or not the government is not at this point thinking about anything to do with any mandates for vaccines. We are in the phase of public education, getting availability and widespread dispersion of the vaccines in the island, and creating incentives for persons to take the vaccine. I think that is the phase that we have to work on and we have to focus on. I have confidence that the Jamaican people, once they buy into it, that they will accept it. We have a long and deep history of vaccines. Almost all Jamaicans would have taken some vaccines at some point in time when they were children. And so, you know, whilst it befuddles me every time that I see the discussions and the propaganda, some of them, it befuddles me. But it is what it is, and we accept that this is how it will be. And our job is to educate and bring our people along, and that is what we will be doing.
And sir, again, employers just want to know if there then would be variations to the work period, work time.
No, they employ. What we have tried not to do is to become too granular, as you would see in the measures. It's very difficult for the government to start going into these kinds of details. We set up a broad parameter, and we expect that the various agents, employers, whoever, they will maximize within the parameters to ensure that there's productivity continuing and they can continue to earn.
Thank you, sir. Now to Ms. Zara Burton. Zara? Zara, unmute and you can ask your question.
Good evening, everybody.
Good evening.
I have 3 questions following up on Jamila Maitland's question a moment ago about the numbers of hospitalizations and how many of those are vaccinated. I wanted to get confirmation of a couple of things, please. One, is it fully vaccinated or just with 1 dose? And are these hospitalizations COVID-19 hospitalizations? Just confirming that as well. And also, I heard Minister Tupton say a few, and I wanted to know what is a few, you know, in terms of actual numbers that would fit that bill. Hospitalized with COVID-19 that were either vaccinated fully or single dose. That's 1 question. 2 question now, and this is just generally on the compensation fund. I know that there are some individuals on the rare occasion that will have adverse reactions. Will the government consider having a compensation fund for those persons rather, you know, than just not having any kind of, let us say, protections right now? Thirdly, and this is for Prime Minister Holness. Prime Minister Holness, were you made aware by the Integrity Commission of the parliamentarians that were being referred for prosecution regarding their statutory declarations? And additionally, could you rule out for the Jamaican public that you and or your wife are not being referred for prosecution?
So the CMO will respond to the COVID questions.
Hi, good evening, everyone. Okay, so in response to the question on the vaccinations of hospitalized patients, first of all, I just want to remind the public that the vaccines are extremely effective against the severe illness and hospitalizations and deaths. And all the vaccines have been shown to be effective in that way. We recognize and we do know that many persons who have gotten the vaccine may get a mild illness. And right now, when we're in a surge and a lot of people are being vaccinated, we do expect that there are many people who will be vaccinated, especially after one dose, in a situation where we have a large number of cases that we may have persons that are vaccinated that will get COVID-19. But we don't expect a lot of hospitalizations. Right now, what we have seen exactly reported are 2 cases that have been reported. And we are looking at these cases to find out, first of all, is it 1 vaccine or 2 vaccine, and what is the period between the vaccination and the persons becoming infected? Because this is important for us to note. But I just really want to caution members of the public to let them know that, yes, you can get a mild illness having received the vaccine, and you can transmit. So everybody needs to take precautions, but the vaccine remains quite effective against preventing severe illnesses and hospitalizations. And that's what we have to bear in mind. Thank you.
Thank you so much. And so it being exactly 8 o'clock, I believe we can wrap the press conference. Any other question relating to other matters, I believe the appropriate authorities would be able to respond. And so I would refer our reporter there. Prime Minister, your final comments on our COVID issues.
Firstly, again, let me thank Dr. Lindsay. And by the way, there are 2 Dr. Lindsays here. Dr. Lindsay is accompanied by her brother, Garfield Lindsay, and you would probably be surprised, both of them were awarded their PhDs on the same day. It's Dr. Garfield Lindsay, who is at the University of Maryland, I gather. You've just gotten your PhD in health sciences. So 2 great Jamaicans contributing globally, 2 great Clarendonians. So that's amazing. Thank you, Dwight Peters. So in closing, again, let me thank the journalists who participated and the listening public. We are in the upward swing of a new surge. We are treating it as if the new variant strain is in Jamaica. Certainly, clinically, the symptoms seem to suggest that. The rapidity of the spread suggests that, because the new variant strain seems to be far more virulent and infective than previous strains. And therefore, it is going to create a more rapid rise in the numbers. So we are preparing for that. We are acting preemptively. But it is important that every single Jamaican follows the protocols. We know masks work. We know sanitizing your hands work. We know remaining 6 feet apart, that works. But especially if you are ill with any flu-like symptoms, a little cough, a little sneeze, a little fever, not feeling so well, Tana your yard, stay at home. For the new variant especially, it is now most important that if you are feeling anything to suggest that you are ill, and particularly for young people, stay at home, quarantine, isolate yourself until the situation resolves, get tested so that you know exactly what is the situation. Observe the non-clinical measures that we put in place, things like the curfew hours. Observe them. For now, we can't have any party and entertainment events and so forth. Pull back a little bit. We had an opportunity a few weeks during our traditional independence period. So let us all now act responsibly and pull back. We can beat the virus by how we act socially and how we choose to seek our medical solutions, meaning if we act responsibly socially and take the vaccine when it is your turn and when it is available, we will come out of it quickly. What we can say in closing is that, I was optimistic that by the end of the year, we could be seeing the light at the end of the tunnel. And we had actually projected that in August, we would have the vaccines and then we would ramp up. But with the constant emergence of new strains, which the experts tell us is cultivated in the unvaccinated population by virtue of them being able to host the virus in greater load and being more infected, it would appear that we may have a longer stretch in the pandemic. And it's not going to be always possible for this action, closing down, curfew hours, this kind of thing. This is not feasible for much longer. The only feasible solution is for us to take the vaccine. So, ladies and gentlemen, thank you.
Thank you so much, Prime Minister, for hosting the media briefing this evening. Thank you to the members of the media who are online. Our apologies to those who had their hand up and didn't get to ask a question. We did announce we'd end at 8 p.m. Thank you to the Minister of Health and Wellness, Dr. Christopher Tufton, the Honorable Desmond McKenzie, the Minister of Local Government and Rural Development, as well as the Permanent Secretary in the Ministry of Health and Wellness, Mr. Dunstan Bryan, the Permanent Secretary here at the Office of the Prime Minister, Mrs. Audrey Sewell, the CMO, Dr. Jacqueline Bisesa McKenzie, our special guest, Dr. Sandra Lindsay, and of course her brother, and all those who joined via social media, and of course the traditional media who brought us live. May we wish for you a safe and enjoyable evening. Good night.